morning, sir.
Good morning.
I am Nurse Sant. Can I get your name, please?
Steve Bartholomew.
Okay, Mr. Bartholomew. Today I want to do an assessment, or better known as examination, of your musculoskeletal system. This will involve me looking at you, touching you, and asking you to follow some simple instructions. If at any time you get in any pain or discomfort, you can tell me and we will try to adjust to suit until you're more comfortable. Anything we do here will be done in strictest confidence and will only be passed on to your healthcare provider. Do I have your permission?
Definitely.
All right, okay. So now I would ask you to go into a gown for me. Normally I would ask the client to go and put on a gown because we have to assess all the joints. Okay? So we will start. All right? I would like you to start by standing here for me so we can do base of support. Right, so can you stand with, right? Patient able to stand upright and weight bear independently. All right, can you walk forward for me? Patient is able to walk with toes pointing forward and head up. There is alternate arm swing with foot position. All right, that's all. Can you have a seat? All right, we are going to assess the temporal mandibular joint. What we do first is we look. Okay, can you take a breath? Thank you. So we're looking at the temporal mandibular joint. We are looking for any redness, any swelling, any obvious deformity. None is seen. Then we are going to touch. I'm going to touch you now, sir. Okay? I am now going to touch you now, sir. Okay? All right. Tell me if you're having any pain. Any pain?
No.
Patient verbalized no pain of the temporal mandibular joint. There is no heat felt, no masses felt. Okay, we are now going to do a range of motion exercise. Open and close your mouth, please. Right. Move your chin from side to side. Okay, push your chin out and bring it back in. Right. Are you getting any pain?
No pain.
All right. So patient had no pain during the range of motion of the temporal mandibular joint. Mouth was able to open and close and chin was able to move from side to side. Okay, now we will move on to the sternoclavicular joint. Alright, so I'm going to look at your sternoclavicular. Again, we're looking at the sternoclavicular joint for any redness, any swelling, any obvious deformity. None seen. I am now going to touch you. Please let me know if you're getting any pain. Any pain?
No pain.
Okay. Patient verbalized no pain on palpation of the sternoclavicular joint. There is no heat. There is no swelling felt, no masses felt, right? And there is no range of motion for the sternoclavicular joint. We are now going to go on to the cervical, lumbar and thoracic spine. Can you stand for me, please, sir? We are assessing the spine. We can see what we are supposed to see, which is the cervical part is concave. The thoracic part is convex, and the lumbar part is concave. The patient, there is no bending, abnormal bending seen. Right? There is no redness seen. There is no swelling seen. So I'm now going to touch you. Please let me know if you're getting any pain. Any pain?
No.
We palpate down the spine. Any pain?
No.
All right. Patient verbalized no pain, no heat felt, no masses felt. We are now going to palpate the paravertebral joint. All right. We're going down. Any pain?
No pain.
Patient verbalized no pain, no heat felt, right? No masses felt. I'm standing behind the patient to assess the cervical spine. I'm going to ask the patient to put his chin to his chest so that I can see the cervical spine. Cervical spine seen, no swelling, no redness, no deformity. So I'm now going to touch you, right? Any pain?
No pain.
Patient verbalized no pain on palpation with cervical spine, no heat felt, no masses felt. Right? Okay, so we are now going to do range of motion of the cervical spine. So I would like you again put chin to chest, flexion, chin up, extension, chin to ceiling, hyperextension. You can bring it back to a neutral point. Now I would like you to put your right ear to your right shoulder and your left ear to your left shoulder, lateral bending. Okay, back up, right chin to right shoulder and left chin to left shoulder. Right, rotation. Any pain?
No pain.
Patient had smooth symmetrical movement through the range of motion of the cervical spine, which included flexion, extension, hyperextension, lateral bending, and rotation. So that is the cervical spine. Now we are going on to the lumbar thoracic. So now I would like you to bend and touch your toes slowly. Flexion, you can come up. Okay, put your hand on your hip and bend slightly back. See if you can bend back. Alright, any discomfort?
No.
Alright, hyperextension. Now I would like you to slide your right hand down your side, okay, and then the left hand down your side, lateral bending. Alright, I would now like you to rotate your left shoulder to the right and your right shoulder to the left. Rotation. Any pain?
No pain.
Alright, so that is assessment of the lumbar and thoracic. Right, patient was able to portray flexion, hyperextension, lateral bending, and rotation without discomfort. Right? We are going on now to the shoulders. Right? Please stay standing for me, sir. So we are looking at the shoulders. We are looking at both shoulders and comparing both shoulders. We are looking, they're both horizontal, right? One is not higher than one. We're looking to see they're both the same size. We can see that there is no swelling, no redness observed. Right? Then we're going to look at them one at a time. So, sir, I'm now going to touch you. Please let me know you're getting any pain. You feel no any pain?
No pain.
Right? Any pain?
No pain.
Patient verbalize no pain on palpation of the right shoulder. May go to the left shoulder. Any pain?
No pain.
Any pain?
No pain.
Alright. Patient verbalize no pain of the left shoulder. There was no heat felt and no masses felt. Right? Now we are going to do range of motion of the shoulder joint. Right? So what I would like you to do is follow me. Put your hand behind your head like this. External rotation and then like this, internal rotation. Are you getting any pain?
No pain.
I am going to check resistance. Alright? Resist me pulling your elbow forward. Alright? Patient has good resistance. We are now going to do abduction and adduction of the shoulder joint. So again, follow me. Abduction. Any pain?
No
Put your
pain.
hand together like this. Abduction and then like this. Adduction. Any pain?
No pain.
Patient verbalize no pain during abduction and adduction of the shoulder joint. Now we are going on to the elbow. Again, we are to compare both sides, right? We will look at both sides. We will look for that they are similar in size, that there is no swelling, no redness noted. So I'm now going to touch you. Please let me know if you're getting any pain. We feel around the elbow. Any pain?
No pain.
And then we feel the actual elbow joint. Any pain?
No pain.
Alright. Same thing on this side. We feel around the elbow and I feel the actual joint. No pain?
No pain.
Patient verbalized no pain on palpation of the elbow. There was no heat felt, no masses felt. We are now going to do range of motion of the elbow. Okay? So you can follow me. Flexion, extension. Right? Flexion of the elbow, extension of the elbow. Any pain?
No pain.
Alright, so put your hand on now. This is supination and pronation. Supination and pronation. Any pain?
No pain.
Okay, patient verbalize no pain on range of motion of the elbow joint. We are now going on to the wrist. So again, we're looking at both. We must compare. We must compare. Alright, they're both similar in size. There is no redness or swelling noted. There is no deformity seen. I'm not going to touch you. Any pain?
No pain.
Any pain?
No pain.
Patient verbalized no pain on palpation of the wrist, no redness, no heat felt, and no masses felt, no deformity felt. We are now going to do range of motion of the wrist. Okay, so you can follow me. Flexion, extension, hyperextension. Okay, any pain?
No pain.
Okay. Radial deviation, only your wrist, radial deviation, ulnar deviation. Any pain?
No pain.
Alright, so patient had no pain on range of motion of the wrist. We are also going to test for carpal tunnel. So I'd like you to put your hands together like this. Are you getting any pain?
No pain.
Alright, so patient verbalized no pain, therefore no carpal tunnel. Right, we are now going to do fingers. Can you see your fingers? Okay, so again we are comparing. They're all similar in size. Right, there is no redness seen, no swelling seen. We're going to touch now. Any pain?
No pain.
Pain? Any pain? Patient verbalized no pain on palpation of the finger joints. There was no heat felt, no masses felt, no crepitus felt. We are now going to be doing a range of motion of the fingers. So flexion, extension, hyperextension. Okay? Fingers apart, abduction, adduction. Abduction, adduction. Any pain?
No pain.
Right, patient verbalized no pain to range of motion of the fingers. So now we are going on to the lower extremities. We are going to do the hip. Right, so we're going to look at the hip. Again, we'll look at, as we did for the shoulder, we're looking to make sure the hip is horizontal. One is not higher than the other. Right, we're looking for redness, we're looking for swelling, none seen. There's no deformity. I am now going to palpate the hip for stability. Alright, any pain?
No pain.
Alright, patient verbalized no pain. Any pain?
No pain.
Right, patient had no pain, no heat felt, and the hip is stable. We're now going to do range of motion of the hip. We need to go on the bed. So what I need you to do is take this leg away from the body, right? Any pain?
No pain.
And back. So next time, so patient was able to do abduction and adduction with no pain. I'd like you to take one leg and run it up the other leg, please. Run it down. Any discomfort?
No.
Next one. Okay. Alright, no pain. Alright. We're now going to do internal and external rotation of the hip joint. So just relax, bend the knee. Bend the knee. Alright. Any pain?
No pain.
Any pain?
No pain.
Alright. Any pain?
No.
Any pain?
No.
Alright. So patient had internal and external rotation of the hip joint with no difficulty. Now I'd like you to lie on your belly for me, please. We're going to do hyperextension. Alright, so I would like you to take one leg at a time and lift it up in the air. Alright, next one. Any pain?
No pain.
Alright, so patient was able to hyperextend leg, again without no discomfort. That's it, thank you. Alright, we're now going to assess the knee joint. Again, we have two knees, so we compare. We look at the knee, compare, they're both similar in size. They don't have to be exact, they just have to be close in size. There is no swelling, no redness, no deformity seen. Now we're going to palpate the knee. So again, we feel around the knee and then the actual knee. Any pain?
No pain.
We feel around the knee and then the actual knee. Any pain?
No pain.
Alright, so patient verbalized no pain on palpation of the knee joint. There was no heat felt, there was no masses felt, no deformity noted. We're now going to do range of motion of the knee, right? So knee up, flexion, extension, hyperextension. Next one, knee up, extension, hyperextension. Any pain?
No pain.
Patient was able to do flexion, extension, hyperextension of the knee joint with no pain or difficulty. Now we're going to the ankle, right? Normally again what we would do, we would compare both sides to make sure they're similar in size. We'll look for redness, for swelling, any deformity. None observed. We would palpate again. Any pain?
No pain.
Any pain?
No pain.
Patient verbalized no pain on palpation of the ankles. No heat was felt. No masses was felt. No deformity noted. Okay? Now we're going to do range of motion. Right? We're going to do dorsiflexion. Right? Any difficulty there?
No pain.
Okay. Right? Patient is able to do dorsiflexion and plantar flexion of the ankle. We're also going to do stand like this, close. Abduction and adduction, abduction and adduction. Any pain?
No pain.
Alright, patient verbalized no pain. Alright. We will also do eversion. So you eversion and, this is inversion and eversion. Inversion and eversion. Next one, inversion and eversion. Right? Any discomfort?
No.
Patient had no discomfort. But the toes will be the exact same way that we did the fingers. Again, we're looking for redness, we're looking for swelling, we're looking for deformity. If none is found, we palpate for heat, for pain, for masses, and we will do the same abduction and adduction of the toes. And that is the end of the MSK. Sir, thank you very much. Do you have any discomfort at any time?
Very much comfortable. No problems.
All right. So there was no obvious issue, and I will pass on this information to the healthcare provider.
Thank you.
Okay, thank you very much.